does cranberry juice really work? Joining us to talk about what a UTI is and how to prevent them, we've got Dr. Marjorie Dixon. Let's start, for all the people that don't know what a UTI is, what is it?
So UTI literally stands for urinary tract infection. So it's an infection in any part of the urinary tract, and what we know about our urine is that it's stored in a bladder, so that's part of the urinary tract. The urethra, which is the tube that leads out of the bladder, and then that's the lower urinary tract. You can also have an infection of the upper urinary tract, which is where the urine is manufactured, so your kidneys, or the ureters, which are the tubes that connect the kidneys to the bladder.
Okay, so in all of those places, if there's an infection.
That's correct.
How prevalent are they?
It's huge, actually. It's a worldwide global issue. 8 billion doctor visits annually worldwide.
That is a lot.
It's the #1 bacterial infection.
Yes, well, I'm sure, I mean, half the audience, we've been there, haven't we, ladies?
Well, funny that you say that.
Right?
Because the audience is primarily women.
Yeah.
And women are 20 to 1 man likely to have a urinary tract infection.
Yes, I have actually never known a man to have one.
They do get them because
maybe they just don't talk about it.
Well, no. Well, maybe they don't talk about it. Men don't talk a lot about things. But
yeah.
I'm not dissing them. Women talk about a lot of things. But urinary tract are more common to happen in women because of the way that we're made, because of our anatomy.
Okay. What is it about our anatomy that makes us more prone to infection?
Do you want me to show you? I'll show you.
Yeah, show me.
My thing. So this is not real, but it's a pelvis.
Really?
Really. And if you see the proximity or the relationship, this is the bladder, and the urethra that leads out of the bladder empties into the top of the vagina.
Yeah.
Right? The vagina has its own bacteria, but that's not the bad bacteria, really. The problematic bacteria comes from the rectum, and the rectum is pretty close to the urethra, right?
Okay.
Yeah, and the rectum is kind of a dirty place, right?
Well, there's dirty stuff coming out of it.
You know, so the bacteria, it is what it is. So the primary bacterial problem actually is a bacteria that colonizes the rectum, which is called E. coli. It's the #1. 85% of bladder infections are related to an infection that comes from the bladder, from the rectum.
Well, I'm going to stop you right there because we're going to do a little quiz.
Okay.
Okay. We're going to talk a little bit about prevention because you gave us a good little lesson right there.
Okay. All right.
All right. We'll start with a big one. I'll get the audience to weigh in. Everyone thinks this. Drink plenty of liquids, especially water, if you have a UTI. Drink plenty of liquids, especially water, if you have a UTI. True or false? True, 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 true. One false. What do you think, Marjorie?
Oh, she was false. She changed to true. But yeah,
okay.
That's right.
That was a mistake.
She's like, don't point me out.
Are they right or are they wrong?
They're absolutely correct. Good
yes,
job.
Good.
Yes.
Good.
Absolutely.
Water, water, water.
Because you can dilute, because it's measured in the amount of bacteria that colonizes the bladder or the urethra and irritates, it's important to dilute that. Now, when you're about to take the antibiotics, if you get antibiotics to treat it, don't drink so much because we need the antibiotics to be concentrated to stick around, to be concentrated.
Okay, that's a good tip.
Yeah.
Okay, drink cranberry juice. True or false? Drink cranberry juice if you have a UTI. True or false?
Cranberries are magical.
Mostly false, but some true.
It's just changing now. No.
What is it?
It's false.
False!
Yes. False! All of the studies that looked specifically to see if there was any property of the cranberry that would be beneficial that didn't show any distinctive or definitive benefit.
I wonder why we think that.
You just got to, I don't know, people come, old midwives' tales, you know. Or not midwives, old wives' tales, no offense to midwives.
Okay, here's another one. Wipe from front to back. Remember the anatomy lesson we just had? Wipe from front to back to prevent a UTI. Is that true or is that false? True all around, except for one false.
She changed it.
I mean, except all true.
All true. Good job.
True.
Yes. Absolutely. Yes, absolutely. One of the #1 things you can do is to wipe from front to back. So when people have recurrent UTIs, one of the questions I ask is, how do you wipe?
Yeah.
So because,
and then you get embarrassed.
Well, you don't have to be embarrassed. Knowledge is power. That's why we're here to let people know. If people are getting recurrent UTIs, particularly in the premenopausal women, it's like, make sure that you're teaching your daughters that you wipe from front to back.
That's right. Okay. Yeah, we went through that lesson at our house. Okay, empty your bladder soon after intercourse. True or false? Empty your bladder soon after intercourse. True or false? True, 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 true. False, false.
True.
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 It helps.
Yes.
It
So
helps.
it can help. It's not for everyone having intercourse. Some women have intercourse without any issue, but for
Yeah.
those women who are having repeated bladder infections after intercourse, it's
Yeah.
primordial to void or to empty your bladder after
Okay, so
intercourse.
it does do something. What are the
Yes.
symptoms? How do you know you have a UTI?
So it's urgency, so I have to go to the bathroom and you have to go right away.
Yeah.
Frequency, so you pee and then you think you're done and then you have to go again. That's
Yeah.
frequency. And then burning, so what we call dysuria. So burning, it's a sign of irritation of either the bladder or the little tube, the urethra that leads out of the bladder, out of the body. And often people, it can get worse. If it's not treated, it can ascend. So the bacteria goes up and it lives and it gets happy and comfortable. If it backs up further, it can lead to something called pyelonephritis, which is of particular risk to women when we're pregnant. Because as the uterus grows, it changes the anatomy, right? So it presses on the bladder so it doesn't empty as well. That's why when you're pregnant, you're like, oh, gotta go. So women are more likely to have infection when they are pregnant. And then also that infection can then ascend and cause a pyelonephritis, an infection. And if you get infected while you're pregnant, it can actually lead to preterm labor.
Oh my gosh.
Yeah. So
you
it's
gotta
very
stay on
important.
top of
You
that.
got to stay on top of it. It's not something that should be not looked at. When
It's
you do it.
fairly easy to stay on top of it though because it hurts.
Yeah, so if you're having symptoms, the first
Yeah.
thing you do, how does it get diagnosed? You talk to your healthcare provider
Yeah.
and they take a sample of your urine. They may actually just dip it in the office. That's usually the screen, the urine dipstick. And then when we see that there are white blood cells or nitrates in that dipstick, then we will treat on spec. The most common things that we see are E. coli. We treat it with nitrofurantoin, but we also send that sample off for culture and sensitivity just in case it's one of the other more unusual causes of
Got it.
urinary tract infections.
How are
And
you treating it?
with antibiotics. Yeah.
It's the only way and it's the easiest way and it's
Bacterial,
effective.
yes, and it's effective. But that's why it's so important for that urine to be sent off for culture when it's a recurrent urinary tract infection or a urinary tract infection that doesn't respond to the initial empiric antibiotics, the antibiotics that we will give off the bat as the speculative one to treat the 85% most common bacteria.
Yeah.
Because sometimes if it's the more unusual types of bacteria that can be the etiology or the problem in your urinary tract infection, you have to use the antibiotic that's specific for that organism.
Okay, that's really good to know. Is there anything else we need to be doing to not have a UTI anymore? Because isn't intercourse part of the problem?
Well, in premenopausal, you can kind of divide it into premenopausal and postmenopausal women. Premenopausally, it's intercourse. That's one of the main things. And then in pregnancy, when your immune system goes down and your uterus grows, you also have that anatomical variant. Postmenopausally, again, we've talked about this, when estrogen goes away, things change. So the mucosa, the lining of the tube that leads from the bladder and the lining of the bladder also changes in its ability to do things well. And part of the protective ability to keep bacteria out goes away. So you're more prone to getting that. And then if you're, as we get older, more common to get these bladder infections when you're in a nursing home. If you need to be catheterized, that will allow for ascension of bacteria. So that's another way that it gets in there.
Okay, good to know. Make sure you know the symptoms. Go to
know
your
the symptoms,
doctor
treat
so that you
early
can get
so that you don't get sick.